Hi everyone, my name is Urusha. I work as communication specialist for the CSU Health Network. My pronouns are she, her, hers. And in today's presentation, I'm going to give you a brief overview of all the services that are provided at CSU Health Network and also talk about some new student requirements and recommendations. All the information that I will share in the presentation today is on our website at health.colostate.edu. And in the chat function, you can see that I have shared some useful links so that you can reference our website and all other pages as I'm going through the presentation, if that is helpful for you. And I will have questions, I will answer questions at the end if you have quite specific questions about different services or anything like that, but we'll leave time for the questions at the end. So let's get started. So at CSU Health Network, all enrolled students have access to a wide range of services regardless of their insurance plan. So for all domestic as well as international students, all enrolled students have access to a wide range of services, regardless of the insurance plans that they are in. Some students think that, oh, I need to have, I need to have a specific insurance to access all the services. That's not true. You have access to all of the services. We'll just bill your insurance. We offer integrated care for the whole student, which means we offer not just medical, but we offer mental health, and we also offer health education and prevention services. We have 200 plus providers and staff members. So these are board certified doctors, providers, and medical professionals who have gone through rigorous training and have worked with us for over 10, 20 years, and they love working with college students like you all. So our services are divided into three categories: medical, mental health, and health education and prevention. So under medical services, we have primary care. So you can think of it like your regular doctor's office. Anytime that you go to get treated or anything happens, you just show up, make an appointment, and see a doctor. So that's primary care. We also have pharmacy on the first floor. So anytime if you want to pick up your prescriptions or transfer your prescriptions, you can do that. We have immunizations on the second floor. So if you want to get any vaccine like COVID, flu shot, or any other required vaccinations, which we will get to in a little bit, you can get that in our facility. We have lab, radiology, behavioral health. So let's say if you want to get your blood work done, you can also do that in the lab over here. We also have specialty medical services like dental, optometry. So let's say it's end of the year and you want to do your annual dental checkup, teeth cleaning, all of that is possible. We also have optometry, so you can get your contacts, prescriptions for your glasses, sunglasses, all of that is. We also have physical therapy. So if you get injured, we have like certified physical therapists who come from different hospitals in the community. We have sexual and reproductive care for all genders. We also have sports medicine, orthopedics, travel medicine, care for disordered eating, all of these LGBTQ plus care, all of these services are available under one roof. So mental health services. So a lot of students, when we talk to international students, they think that, oh, to utilize the mental health services, we need to pay a certain cost, but that is not true. Your counseling fee, a part of your student fee that is already paid, already provides access to a wide range of mental health support resources. So you do not need to pay anything extra to utilize mental health services, except for psychiatric services, of course, because that's a specialty. But other than that, for most of the services, you do not have to pay anything extra. And we have brief individual counseling, therapy groups, skill building workshops, and I can tell you what each of them are. So the first time you come to the health network, you will talk to an on-call counselor for about like 10 to 15 minutes. And in that brief interaction with the counselor, you and the counselor together will decide what's the best program for you. So it's not guaranteed that everybody will get individual counseling, but it really depends on your specific needs, identities, and your preferences. So and then after that brief interaction, the counselor might refer you to, all of these programs that are listed on the screen. So therapy groups are for students who are going through like, different situations. So we have neuro-inclusive group, we have body positivity, there's exploring relationships after trauma, there is mindful meditation and yoga. For students who are going through anxiety, there's taming the anxious mind. So for all of these therapy groups, you'll just have to speak to an on-call counselor and we just go through that brief screening process. We also have skill building workshops. And skill building workshops are those that you can register for anytime, anywhere, and you can choose to attend in person or on Zoom. So you do not have to go through any screening process or talk to any counselor for this. And I can give you examples of some workshops that we offer. We have mindfully managing stress because that's the most popular one that a lot of students sign up for. We have improving sleep and well-being if you're struggling with sleep. We have international conversation hour that might apply to, the student population, right? So this international conversation hour is a place where you can talk to counselors. It's a non-judgmental group where if you are going through any problems or if you want to build a community, you can do that. It's an online a session over Zoom. So you can register for this by going to our website. And the link is also in the chat function that I just shared. And there's also cannabis nicotine management. So all of these workshops are, you can register for those anytime from anywhere. We also have drugs, alcohol, and you program, post-hospitalization support, and crisis intervention. So how can you access mental health services? So like I just mentioned, for the skill building workshop, there's no screening or referral required. And there are also some online 24/7 tools that I'll talk about in a little bit. And we also have something called multicultural counseling services. So these are especially for students who come from different backgrounds, nationalities, cultures, and are going through, unique situations and unique problems in their college life. So these MCC, Multicultural Counseling Services, are offered every day of the week. So if you go to Google and type in Multicultural Counseling Services, CSU Health Network, then you will see the list of counselors and the hours. So it might differ every day. So Mondays it can be like 1 to 5, and Tuesday it can be like 9 to 10. So these are like drop-in hours that you don't need to make an appointment. You can just come in, for MCC during the days that best that you are free and available, and you can just say that, hey, I'm here for MCC, and you can talk to the counselor without making an appointment. So that is available. And for all other services like therapy groups, individual counseling, psychiatric services, post-hospitalization support, you'll have to go through that brief screening process, which I just told you about, that you'll just, speak to a counselor. I won't go into much detail about these services, but I still want to mention these. So through Health Education Prevention Services Office, we offer substance misuse prevention, mental health initiatives. So if you are someone who is interested in, health or like pre-med or biology or any of the health sciences, then if you want to get some experience, you can work for us also. We offer a lot of student employment opportunities through the Health Education Prevention Services. We also have peer education crews. So it's basically a student-led group whose objective is to empower students to make informed choices related to sexual health, alcohol consumption, and cannabis. So if you're interested in gaining experience and being part of these different initiatives and well-being initiatives and sexual health initiatives, you can contact us. And we also have business services on the second floor. So if you have any questions regarding your health insurance, about your private insurance, about your medical record or anything like that, you can just come to the second floor of the CSU Health Network and go to business services, and they'll be able to assist you. So this is the building that I was talking about all this while. This building houses all of the services that I mentioned. This building is located off of Lake and Prospect. So this building is only 10-minute walk from Lowry Student Center from the center of the campus. And there are several ways to get there. There's a bus that takes you from Lowry Student Center to our building. There's plenty of parking for bikes and cars. And yeah, there's so many, ways to get here. It's very accessible. It's just 10-minute walk from Lowry Student Center. So if you see this big building, and this is what it looks like. So why should you come to the health network? So to help with your medical and mental health needs. So what do we believe is prevention is better than cure, obviously, right? So don't wait until the last minute when you're not feeling well, or like even if you think just like talking to a counselor will help in just making yourself feel better or anything, just know that we are there for you at no cost. And we'll talk about insurance in a little bit, but international students are already automatically enrolled in the health insurance plan, so you don't need to even, worry about paying anything because most of the time it's already covered by your insurance. So when are what are our hours? We are open Monday through Friday, 8 a.m. to 5 p.m. And if there are any closures during university holidays or public holidays, all of those will be mentioned on our website. So yeah, don't wait, come early when problems are just starting because sometimes, especially with international students, a lot of them don't even know that, this resource is available to me for free. And they think that, oh, everything must cost money here. So why should I just go and like pay money for all these resources? So yeah, come early rather than just, waiting for the problems to become worse. So this is our number. If you want to save it right now, please go ahead and do that. But this is the primary number and the only number that you need to make an appointment. You can also walk into our services. Obviously, appointment, we encourage students to make an appointment online. You can also do that by going to our website, which I'll show you in a little bit. But Monday through Friday, 8 a.m. to 5 p.m., you can also walk in anytime and then just show up and make an appointment then. The wait times might be longer versus when you make an appointment, but that walk-in option is also available. So after hours and emergency care. So you must be thinking like, okay, like what do I do if I get sick on a Wednesday night or in the weekend? Like, what can I do? So for those, we have after hours nurse helpline. So if you call the general number, which is the 7121 number, there will be after hours nurse helpline. So our facility does not work like an urgent care, but we operate like a doctor's office, which is open only from 8 a.m. to 5 p.m. But after that, you can get medical advice, but you cannot come see us. So the after hours nurse, will be there to assist you if you have any medical problems or if you need, finding care in the community. So if you call that number, we have after hours nurse helpline. We also have mental health crisis intervention. So if you call the same number, you can also talk to a counselor. So let's say it's Friday at 2 a.m. and you're suddenly feeling really anxious and you need help, just like, regulating your emotions so that you can feel better. You just need to talk to someone. You can call that number and, ask to speak to an on-call counselor. And maybe, even for a brief moment, talking to someone who's a, certified professional can help you with your situation. And then obviously if it's life threatening, you'll have to call 911 and go to the you have to call 911 and report them. But there's also information about urgent care and emergency room facilities on our website. So that information is also available. So yeah, like I said, in the event of a life-threatening emergency, you'll have to call 911. And these are the emergency room and hospitals that are in network and are in the community. That will be the closest when you're here, just in case, something happens. So how will you pay? So like I said, your health insurance helps pay for medical services here, and what you owe depends on your health insurance plan. But in the case of international students, you're automatically enrolled in health insurance, and your student fee already pay for a lot of mental health support resources. So I want to talk about requirements and recommendations. So all incoming students, regardless if they are domestic or international, must submit immunization records. So 2 doses of MMR is mandatory for everybody. So as long as you had MMR anytime in your lifetime, that works. And then I know with international students, a lot of students have questions about like, oh, the records are in my language. Like, do I need to translate those, or like, how do I go about that? So if you are able to translate your records in English, that's great. But if you're not able to translate it by yourself, you can also send us, the record in your native language, and we'll try our best in translating. And then if from our end, if it's not possible, we'll, contact you again. But yeah, so that's the answer to that question. And for all students who are living in the dorms, inside the university, they are also required to submit the meningococcal vaccine. And it's not meningitis B, but it's meningococcal ACWY, just so you know, given in the last 5 years. And you'll submit all these records online through the CSU Student Health Portal only. We do not accept any printed forms or any forms that are mailed to us. You can only submit all your records only through the CSU Student Health Portal, which I'll show you how you can access and how you can submit. And the deadline to submit all these records is Tuesday, January 2026 for spring semester. And if you fail to submit all these records by the deadline, then there will be a hold on your student account, and you won't be able to register for classes, and so there'll be a lot of restrictions. So make sure you submit all your records by the deadline. So this is the main homepage of our website, CSU Health Network. And as you can see over here, there are so many tabs at the top, which takes you to all these different, services that we offer. So this is the student health portal, as you can see with the arrow on the screen. So once you go to the student health portal, this is the screen that you'll see, and you'll log in using your net ID and password. And after that, this is the screen that you'll see. So over here, you can see these are under My Forms. This is where you will find all your forms and documents. If you have any pending forms that you have not submitted yet, you will see it in this section. And if you click on Document Upload, that's where you will submit all your immunization records that I just talked about. And this is the type of screen that you will see. So the green bar shows that you are compliant with the vaccine, and the red bar shows that you have not met that requirement. So you want to make sure that the screen turns green by the deadline, which is January 2026. And sometimes if you wait until the last moment, it might take a few days for our staff members to actually process your record. So it won't show the change in the website immediately. So just be patient and wait for it to go green. And don't wait until the last moment, because the first week of classes, there'll be thousands of students sending like records and information. So you don't want, your student account to be on hold, and then, for us to take a longer time. So start sending all those records right now. So I'm going to play a video about how health insurance works in the United States, and we'll watch this video and then we'll come back for other slides. Welcome to CSU. We are happy you are here. CSU Health Network is your home for health. We provide medical, mental health, and health education and prevention services to students. As a CSU student, you have access to all of our services. We know that accessing healthcare and using health insurance in the United States works differently than in your home country. This video will provide information about using health insurance in the United States and specifically how your CSU Student Health Insurance Plan, also known as SHIP, will work. In the United States, there is no universal health care, and people must purchase their own health plan to help pay for care when medical needs arise. Even so, when you visit a doctor, insurance will usually not cover all the costs. Most of the time, people will pay some amount when receiving health care. Because healthcare in the United States works differently than in other countries, it is important to define some common health insurance terms. A healthcare provider is a licensed medical professional or healthcare organization that provides medical services or treatments to patients. Deductible is a set amount of money you pay each plan year for covered healthcare services that you have received. Your health plan will begin to contribute toward the cost of care after the annual deductible has been met. Once the plan year deductible is met, you will still share in the cost of your medical care. This is when you may hear the terms coinsurance and copay. Coinsurance is a percent of the cost. You and your insurance plan will each pay a percent of the cost of care that you receive for medical services. A copay is the amount that you pay after your deductible has been met for a particular service each time you get that service. Now we'll talk about in-network and out-of-network care. In-network means that the health insurance carrier has a financial agreement or contract with a healthcare provider, such as a doctor or facility, such as the CSU Health Network. Out-of-network means that the provider or facility does not have contract or have a financial agreement with your health plan. Out-of-pocket maximum is the most you will pay for covered healthcare during a plan year. Once the out-of-pocket maximum has been met for the plan year, you will not owe anything more for covered healthcare during the plan year. Plan year is a 12-month period of time during which deductibles, coinsurance, and copays accumulate toward the out-of-pocket maximum. CSU SHIP's plan year is August 1st to July 31st. Out-of-pocket costs are your expenses for medical care that are not covered by your health plan, including the deductible, coinsurance, copays, or non-covered services. For CSU SHIP, international students have a $500 plan year deductible when medical services are received outside of the CSU Health Network with in-network providers. There is no deductible to meet when you receive your medical care at the CSU Health Network. When you receive medical care at the CSU Health Network, you may pay a low copay for some services and no cost for other services. When you use an in-network provider, you will pay a smaller deductible, $500, and coinsurance, 20%. When you use a healthcare provider or facility that is out of network, you will pay a larger deductible, $1,000 instead of $500, and a greater percentage of the cost, 40% instead of 20%. Because healthcare in the US can be costly, it is most cost-effective for students on the CSU Student Health Insurance Plan to start their care at CSU Health Network if possible. You can think of CSU Health Network as your on-campus doctor's office. When you access medical or mental health care at CSU Health Network using your SHIP insurance, you will have very little or limited out-of-pocket costs. This is because for students with SHIP, the deductible does not apply for services received at CSU Health Network. CSU Health Network offers a variety of general and specialty medical services, including dental, vision, immunizations, primary care, pharmacy, physical therapy, and more. To learn about all of the services at CSU Health Network, visit health.colostate.edu. Your CSU student health insurance plan is also in network with many providers and facilities in Colorado and the United States to make it convenient to find care at the lowest cost. When healthcare services are received outside of CSU Health Network, students enrolled in the CSU Student Health Insurance Plan will have a deductible to meet and then either coinsurance or copays depending on the service received. Specific details about what you can expect to pay under the Student Health Insurance Plan can be found at health.colostate.edu/international-ship. As you learned earlier in this video, we encourage you to visit in-network providers whenever possible. If you are looking to find an in-network provider off campus, staff at CSU Health Network or your health plan customer service department can help you. Once enrolled in the student health insurance plan, you should carry your insurance ID card. It can be downloaded to your phone or computer, and you can find instructions on how to download your insurance card at health.colostate.edu/international-ship under the Quick Links section. You should show your health insurance ID card when receiving healthcare so that the healthcare provider can bill your insurance. The insurance ID card also has the insurance customer service phone number on the back if you have questions about healthcare services or providers outside of CSU Health Network. If CSU Health Network is closed or you have an urgent or emergent need, you should seek care at a local urgent care or emergency room. Be sure to bring your insurance ID card. If CSU Health Network is closed and it is not an emergency, the CSU Student Health Insurance Plan also offers online, no-cost medical or mental health appointments 24 hours a day, 7 days a week. More information on accessing online care can be found at health.colostate.edu/international-ship. If you have questions about the CSU Student Health Insurance Plan, please call 970-491-2457 or email chuhn_insurance@colostate.edu. Thank you for watching. All right. I hope that video was helpful, and this video is also embedded on our YouTube channel and also on the ISS page. So if you want to reference it again to understand how health insurance works in the United States. So like it was mentioned in the video, you are automatically enrolled in the CSU Student Health Insurance Plan. But if you want to opt out through the waiver process, the deadline is January 23rd. And I know with some countries and their plans and if there's like employer sponsored plan, there are only a few students who are eligible and are qualified to opt out of the plan. So in that case, if you have other insurance coverage, please submit a waiver request form and a copy of the current insurance policy to the Student Health Insurance Office by January 23rd, 2026. And the accepted waivers that we accept are the employer group health plans, sponsored plans, and individual plans that meet the reform law. And non-accepted waivers are short-term plans, foreign plans, individual plans that do not meet the law. And so, if you have any questions about all these waiver request forms, or whether you want to know whether your plan is acceptable or not, then please email csuhn_insurance@colostate.edu, and please save that phone number, which is 970-491-2457. So other moving on, all the incoming students are also required to submit and complete online modules, out of which there is a module called Alcohol EDU, which educates students about making better decisions when it comes to alcohol, like, what should you do and do not do when you attend parties and things like that. And it is mandatory for all students. And if you do not complete this module, there will again be a hold on your student account and you won't be able to register for classes. So make sure you complete this online module by the deadline, which is Tuesday, January 20. So, and this module will be emailed to you once you get your colostate.edu email address. So you must be thinking, oh, where can I find this module? It will be emailed to you several times until you actually complete this module. So please do that on time. There are also other um, um, you know, modules like Canvas Financial Wellness, which educates you about like budgeting, about like how to use credit cards, and like, gives you important information, all of that. So all of these modules are available 35 days prior to the start of the semester, and it will be sent to your Colostate EDU email address. So please check your inbox. And then we also highly encourage students to create a CSU profile. So remember I told you I would tell you about online 24/7 tools, which are available 24/7. So this is one of the tools. So CSU is an online student success portal, which connects students to personalized on-campus and online resources on campus. So there are so many, like hundreds of resources and offices for students, depending on their different identities, needs, problems, everything. So, and for students who are just starting, you might not know that, oh, okay, I don't even know that this resource even existed. So how do I know what is available to me, right? So in order for you to connect to those resources, make a UHCSU profile by just typing UHCSU and making a profile. And once you make a profile, you can access through your Ramweb account. You put your net ID and password, and then in the search bar over there, you can just type in your, whatever you are going through. So let's say if you type stress over there, it will list all the programs and resources that are available for you that will help you to manage stress. So let's say if you type it, let's say, if you're looking to join a group of people who are come from the same continent as you, or who come from the same, country as you. If you're trying to connect to that club, then you just type in, the name of the country or anything, and then it will connect you to that cultural center or like things like that. So it's very helpful, especially for international students, to find a community and find solution to their problems. So if you have any questions, like I said, please save that general number. All the information that I shared is on our website. And I also highly encourage you to follow us on our social media at CSU Health Network. And I know, including myself, we are more active on our social media sometimes, and then we check it more often than sometimes when we check emails, right? So we also give a lot of important information through our social media on our Instagram at CSU Health Network, and we also do so many giveaways and like quizzes, and you can also ask private confidential questions through our social media, and then we'll take it to the department that you're looking for, and it will remain completely anonymous and confidential. So yeah, follow us on our social media at CSU Health Network. And there's also a contact form. If you go to the main website at health.colostate.edu, if you scroll down all the way at the bottom, there is a contact form where you can ask questions, any question that you have, like about any of our services. And those questions will be directed to the department that you're looking for. And for phone number, you can call this number. And I know for students who are out of the country, email or like contact, asking the questions through the contact form might be easier for you since it's online. So please utilize that resource. And I'm going to stop sharing my screen now, and then I'm going to answer the questions that are in the Q&A. So the first question was how does dental care work? So as part of the your health insurance plan, you automatically also get like basic dental coverage, which will cover, I think, like one dental cleaning in a year, and then there are like few other things that it covers with no additional cost. But obviously, if you need like, to do a root canal or like very specialized treatments, you might need to pay a little bit out of pocket. But there are some services that are covered under your you know, um, general insurance plan. So please go to our dental care page and then you will see, how you can access and making an appointment is super easy. You'll call the number or you'll either go to our website to make an appointment and choose dental care, or you'll just walk in. It's located on our third floor. So hopefully that answers your question. The other question is, if I've received the MMR vaccines but no longer have proof, what could be done? So I know if you want to get vaccines, you can get them here after you arrive in the university. So you can just show up to CSU Health Network second floor and get the vaccine. But if you are very confident that you already, if you recently got the MMR vaccine and then you don't want to get it again, then you'll have to contact our immunizations department. Or you can just show up and don't wait until the first day of class to visit the health network. If you have any questions or if there are any records that are still pending or anything, you can just show up in our office and then they'll be able to figure it out. Or you can also, send your inquiries through the contact form. Thank you. Um, the other question is, I'm an international student. Do I have to take those vaccinations? So, like I just mentioned in the presentation, the MMR vaccine, 2 doses of MMR is mandatory for everyone. And if you're living in the dorms inside the university, then you are also required to submit the meningococcal vaccine. And the other thing is, I think international students are also highly encouraged to take the TB assessment, which is the tuberculosis assessment, which is on our portal. This is not mandatory, but it is like highly recommended so that, for the public safety of our students in the university and for yourself as well. So please do that. And then the other question is the alcohol EDU model compulsory for the graduate students as well? And yes, it is compulsory for both graduate and undergraduate students. And it takes about anywhere from 30 to 45 minutes to complete that module. So, and if you try to skip it, then, I think it doesn't count. So make sure you complete that full module and sit through the whole thing to complete that requirement. Thank you. Okay. Any other questions? And like I said, if you have other questions, you can, there's so many avenues that you can contact us. There's another one that says, I cannot access either alcohol, EDU, or sexual prevention modules. So like I said, it will be emailed to you to your colostate.edu email address. And if you can't access, just type in alcohol, EDU, CSU, and then the web page will have contact information for like if you're going through some technical problems, you can contact that number on that web page, but it will be emailed to you. It was not emailed to me. Well, maybe because you have not registered for your classes yet. That might be one of the issues. But if it's a technical problem, I would say just contact, just type in alcohol edu contact support or on Google, and then, you can email them directly. Thank you. Any other questions? Okay, there's some questions in the chat function. So do I have to take photo of the whole vaccine card or just the vaccines that you mentioned? So as long as the photo that you have, shows all the vaccines that are required, so that should be enough. All right. Thank you so much for attending this program. And, you can always stop by the CSU Health Network, follow us on our Instagram. Once again, I highly recommend it. And yes, thank you all so much, and I hope you have great rest of your day and welcome to CSU.
I think we have two more questions, and we still have 15 minutes left in the session.
Presentation? Okay, cool. Thank you. If we are enrolled in the health insurance from CSU, do we get a card for proof of insurance or do we get an email for it? So, all the instructions on like how you can access the card is available. And so if you go to International Student Health Insurance, if you type in International Student Health Insurance, CSU Health Network, and the link is also in the chat function. So if you go to that, there's instructions on how you can download the card digitally, or you can also fill out a form and they can send Anthem can send the card to you. It's an Anthem comprehensive PPO plan, so they can send the ID card to your address. But you will not get you'll get an email that, you have health insurance coverage, but you won't get the card in the email. The other question that I have is, as per the instructions on the website, I completed the immunization record by my family doctor. Is it okay? Um, this is okay. Yes, as long as it's, legible and it's in English and we can understand it and it, follows and if you're compliant with all the necessary requirements, then yes, it should work. And if it does not work, then we'll contact you and we'll email you. All right. Okay, that's good to know. We have some time left. So if you have any other questions, and if I'm missing questions, let me know if I haven't answered any of those.
I do want to add that if there are no more questions, we will end early. Tomorrow there is another session we have, a pre-arrival Q&A webinar. This is for anyone who has any other questions. This session is particularly for the health network. So we are answering only questions that are associated with that. If you have any other questions, you can reach us through our email. I will go ahead and put it in the chat, or you can attend tomorrow's session. Um, and also just some information that, in case it wasn't emphasized enough, if you have any more questions and you arrive before the start of classes, you are free and you are welcome to visit the Health Network. The Health Network is going to be at orientation if you're attending on January 13th. They will have a booth there. That way you can speak to someone. You will also have an opportunity to visit their offices. There will be some breaks if you arrive early, and you have coverage as of January 1st. So if there's anything you need to get done that includes immunizations, feel free to visit them. But hopefully, we are able to answer all of your questions right now. I see we have one more, and then I think we are going to close things up.
Yeah. Your coverage starts from January 1st, so don't wait until, the start of your classes start. So come in, early. The question was, I'm a student under a scholarship. Do I need the health insurance card? Yes, everybody needs health insurance card. And you need to put it in your wallet because it's helpful, even if, not just coming to the health network, if you go to any other hospitals or urgent care or anything like, health insurance card, everybody needs it. So you'll need to have it ready and you'll need to show it wherever you go. So please try to have it with you at all times.
All right. Well, thank you so much, Arusha, for presenting. Thank you to everyone who attended. Hopefully, we will see many of you tomorrow at the other session. If not, we will see you at orientation. Thank you all. Have a good day.
Thank you. Bye.